Question 1. In the context of X-ray interactions with matter, Mr. Taylor is conducting a radiographic exam of a patient's abdomen. He notices that some areas of the image are very dark while others appear light, suggesting that certain parts of the beam are interacting differently with the tissue. Which of the following interactions is most likely responsible for the observed image variations? A. Photoelectric effect. B. Compton scattering. C. Bremsstrahlon radiation. D. Classical scattering. Answer. Correct answer. B. Compton scattering. Explanation. Compton scattering occurs when an X-ray photon collides with an outer shell electron, causing the photon to scatter in a different direction. This interaction is responsible for the image variations seen in areas where the scatter has increased the overall density of the image. Photoelectric absorption A would have caused more distinct, high-contrast images, while Bremsstrahlon C and classical scattering D different effects on radiation but do not contribute as significantly to image density or contrast variations in the same way as Compton scattering. Question 2. When considering the role of gonadal shielding in radiographic procedures, Mrs. Jackson is preparing for a pelvic X-ray. She is concerned about potential radiation exposure to her reproductive organs. Which of the following factors should be considered when determining the appropriateness of gonadal shielding for this exam? A. The size and weight of the patient. B. The imaging technique and projection used. C. The patient's age and gender. D. The patient's medical history. Answer. Correct answer. B. The imaging technique and projection used. Explanation. Gonadal shielding should be used when the gonads are in or near the primary X-ray beam, such as during pelvic or abdominal radiography. The specific imaging technique and projection B affect the positioning of the gonads relative to the beam, while age and gender C may influence sensitivity to radiation. They are secondary factors compared to technique and projection. Patient size A or medical history D are not directly relevant to shielding decisions. Question 3. Based on the information regarding mobile radiography, Mr. Adams is tasked with performing a chest X-ray on a patient in the intensive care unit. He needs to transport the mobile X-ray unit through narrow hallways and areas with limited space. What is the primary safety concern in this scenario? A. The potential for radiation exposure to other patients and staff. B. The weight of the mobile unit. C. The exposure settings needed for ICU patients. D. The calibration of the unit. Answer. Correct answer A. The potential for radiation exposure to other patients and staff. Explanation. The key concern in mobile radiography is ensuring proper shielding and safety to prevent unnecessary radiation exposure to surrounding individuals, especially in hospital environments. This includes the risk of scatter radiation affecting patients and staff. The weight of the unit B and calibration D are important but do not directly address safety concerns. Exposure settings C are customized based on the patient's condition but are secondary to safety in mobile units. Question 4. To what extent does the ALARA principle apply when performing fluoroscopic exams? Mr. Langdon is conducting a fluoroscopy to assess a patient's gastrointestinal system. How should he ensure compliance with the ALARA principle during this procedure? A. By limiting the number of exposures and using the lowest dose necessary. B. By wearing lead aprons during the exam. C. By increasing the tube current to achieve better image clarity. D. By minimizing patient movement during the exam. Answer. Correct answer A. By limiting the number of exposures and using the lowest dose necessary. Explanation. The ALARA, as low as reasonably achievable, principle emphasizes minimizing radiation exposure while ensuring diagnostic quality. In fluoroscopy, this means using the lowest possible dose for image quality and limiting the number of exposures. Wearing lead aprons B is a personal protective measure but does not reduce the radiation dose. Increasing tube current C may increase dose, which contradicts ALARA, and minimizing patient movement D does not directly impact radiation dose. Question 5. In an effort to improve image quality in digital radiography, Mr. Rodriguez is working with a computed radiography CR system. Which of the following factors has the most significant effect on the image quality in this system? A. The patient's age. B. The grid ratio. C. The exposure technique KVP and mass. D. The processing speed of the imaging system. Answer. Correct answer. C. The exposure technique KVP and mass. Explanation. In digital radiography, the exposure technique, particularly the combination of AVP and mass, directly affects image quality by controlling the amount of radiation reaching the detector and influencing image contrast and noise. C. While the grid ratio B can improve image quality by reducing scatter, it is less impactful than the exposure settings. Patient age is not a direct factor in digital image quality and processing speed. D. May affect workflow but not image resolution or contrast. Question 6. When evaluating radiographic images, Ms. Roberts is reviewing a chest X-ray where she notices some areas with insufficient contrast. What is the most likely cause of this image quality issue? A. Overexposure of the image. B. Underexposure of the image. C. Excessive use of a grid. D. Incorrect collimation. Answer. Correct answer. B. Underexposure of the image. Explanation. Underexposure occurs when insufficient radiation reaches the detector, leading to a loss of image detail and contrast. B. Overexposure A would result in a dark image, while excessive grid use C could lead to grid lines, but not reduced contrast per se. Incorrect collimation D may cause areas of unnecessary exposure, but would not specifically affect contrast in the same way as underexposure. Question 7. As illustrated by recent research on radiation safety, Mr. Lee is working in a radiology department and must monitor personnel radiation exposure. Which device is the most effective for assessing the cumulative radiation dose of radiologic technologists? A. Film badge. B. Thermoluminescent dosimeter TLD. C. Optically stimulated luminescence dosimeter OSCILD. D. Pocket dosimeter. Answer. Correct answer C. Optically stimulated luminescence dosimeter OSCILD. Explanation. The OSCILD is one of the most effective devices for measuring cumulative radiation exposure due to its precision, ability to provide permanent records, and sensitivity. C. The film badge A is less accurate and can be influenced by environmental conditions. TLDs B are effective but are typically used for specific short-term measurements, while pocket dosimeters D reliable for long-term cumulative assessments. Question 8. What factors contribute to the increase in scatter radiation during radiographic imaging? Mr. Johnson is performing a radiograph of a large abdomen. Which factor should he address to minimize scatter radiation and improve image quality? A. Increase the SID, source to image distance. B. Decrease the grid ratio. C. Lower the KVP value. D. Use a larger detector. Answer. Correct answer. Increase the SID, source to image distance. Explanation. Increasing the SID A reduces the amount of scatter radiation because the X-ray photons are spread over a larger area, thus reducing their intensity. Lowering KVP C may reduce scatter, but it also reduces image quality by decreasing photon energy. Decreasing grid ratio B would reduce scatter absorption, and using a larger detector D does not directly reduce radiation. Question 9. When analyzing an X-ray tube, Ms. Taylor observes that the tube is not producing consistent exposure results. Which of the following components is most likely responsible for the issue? A. The anode. B. The cathode. C. The filament. D. The rotor. Answer. Correct answer. B. The cathode. Explanation. The cathode is responsible for providing the electrons needed for X-ray production. If there is an issue with the cathode, B, such as filament failure, the electron production would be inconsistent, leading to exposure variability. The anode A and rotor D are important for X-ray production but would not directly affect exposure consistency. The filament C is part of the cathode and can be considered the failure point. Question 10. Considering the regulatory guidelines, Ms. Henson is assessing her department's radiation safety protocols. Which of the following guidelines is most critical when it comes to ensuring safety during fluoroscopic procedures? A. Increasing current to improve image quality. B. Using higher KVP settings to reduce patient exposure. C. Keeping the fluoroscopy time as short as possible. D. Using a stationary grid for all fluoroscopic exams. Answer. Correct answer. C. Keeping the fluoroscopy time as short as possible. Explanation. Fluoroscopy involves continuous exposure to X-rays, so the most critical safety guideline is minimizing fluoroscopy time. C. To reduce total radiation dose while increasing KVP. B. Can reduce patient exposure is secondary to limiting exposure time. The use of a stationary grid. D. Is not typical for fluoroscopy, and increasing to A. Could inadvertently increase patient exposure without improving safety. Question 11. To illustrate this point, a radiologic technologist named Mr. Daniels is performing a lateral lumbar spine radiograph on a morbidly obese patient. He increases the KVP to compensate for tissue density but does not adjust the mass. The resulting image is underexposed with poor visibility of anatomical structures. What should Mr. Daniels have done differently to produce a diagnostically acceptable image? A. Lower the SID to increase image intensity. B. Increase the mass in conjunction with the higher KVP. C. Add additional filtration to the X-ray beam. D. Apply a compression band to reduce scatter. Answer. Correct answer. B. Explanation. When imaging larger patients, increasing KVP alone may improve beam penetration but is often insufficient for adequate image receptor exposure. Increasing mass directly increases the number of X-ray photons, thus enhancing image receptor exposure. According to the reciprocity law and image quality principles, proper balance of KVP and mass is necessary. Lowering SID-A may magnify the image, introduce distortion. Additional filtration. C. Reduces beam intensity, worsening under exposure. Compression bands. D. Are inappropriate and unsafe in this scenario. Reference are content specifications, exposure technique selection, density and contrast management. Question 12. When considering digital imaging systems, what is the primary advantage of using flat panel detectors over traditional computed radiography (CR) systems? A. Improved portability for mobile imaging. B. Reduced radiation dose due to higher detective quantum efficiency. C. Enhanced chemical processing capabilities. D. Ability to use photostimulable phosphor plates. Answer. Correct answer. B. Explanation. Flat panel detectors in digital radiography doctor offer a higher E, allowing for low radiation doses without compromising image quality. This is a core safety feature emphasized by the ALARA principle. CR systems use photostimulable phosphors. D. Not octa option. C. Is outdated. Doctor systems are digital, eliminating the need for chemical processing, while doctor panels are more portable. A. This is not their primary advantage over CR. Reference SRP report No. 172. Reference levels and achievable doses in medical and dental imaging. Question 13. The underlying principle of beam restriction is critical in image quality and radiation safety. What is the most effective reason for using collimation during radiographic procedures? A. It increases magnification for improved visualization. B. It enhances patient comfort during procedures. C. It reduces scatter radiation and improves image contrast. D. It increases the exposure index for better histogram alignment. Answer. Correct answer. C. Explanation. Collimation limits the size of the X-ray field, which reduces scatter radiation, resulting in better image contrast and reduced patient dose. This directly supports the ALARA principle in image optimization. Increasing magnification A is not related to collimation. Patient comfort B is not influenced significantly by beam restriction. Exposure index D is related to receptor exposure and not directly controlled by collimation. Reference SRP report No. 102 and radiation protection guidelines. Question 14. Based on the information MS A shows working in a mobile radiography environment, she is performing a chest X-ray on a patient in an isolation ward. She positions the cassette correctly and uses a grid, but forgets to adjust the SID to compensate. The image shows severe grid cutoff. What technical error most likely contributed to this outcome? A. Improper grid alignment and short SID. B. Using too high, E with no filtration. C. Selecting the wrong exposure time. D. Failure to collimate to the lung fields. Answer. Correct answer. A. Explanation. Grid cutoff in mobile radiography is most often caused by poor grid alignment and incorrect SID, particularly when using focused grids that require precise positioning. High kVp B can increase scatter, but not cause cutoff. Exposure time C would affect motion blur, not grid performance. Lack of collimation D increases scatter, but does not directly result in grid cutoff. Reference Bushong's Radiologic Science for Technologists chapter on mobile radiography techniques. Question 15. Throughout the course of quality control testing, a radiology department identifies a consistent variation in exposure output from the X-ray tube. Which QC test is most relevant to identify this inconsistency? A. Focal spot size test. B. Half-value layer test. C. Reproducibility test. D. Filtration test. Answer. Correct answer. C. Explanation. The reproducibility test evaluates the X-ray generator's ability to produce consistent radiation output at the same exposure settings over time. This test is mandated under SERP and state car regulations. Focal spot size A assesses resolution. HEL B measures beam quality and filtration. Filtration test D checks compliance with minimum filtration standards but not exposure out. Consistency. Reference SERP report No. 99 and quality assurance standards. Question 16. Under the assumption that an elderly patient with kyphosis is undergoing a thoracic spine radiograph, what is the most appropriate adjustment positioning technique? A. Place a wedge sponge under the knees. B. Increase SID to reduce distortion. C. Angle the central ray cephala to match spinal curvature. D. Decrease kVp to minimize motion artifacts. Answer. Correct answer. C. Explanation. In patients with kyphosis, especially geriatric patients, it is often necessary to angle the central ray to be perpendicular to the deformed spine to prevent distortion of vertebral bodies. Knee support A helps with lumbar exams, not thoracic. Increasing SID B helps reduce magnification but doesn't correct alignment. Decreasing kVp D may increase motion artifacts due to longer exposure times. Reference Merrill's Atlas of Radiographic Positioning, Geriatric Patient Considerations. Question 17. With respect to radiation protection, which of the following strategies is most effective in minimizing dose to the rad tech during fluoroscopic procedures? A. Standing close to the patient for support. B. Wearing a thyroid shield and lead apron. C. Using automatic brightness control. ABC. D. Reducing field of view using image zoom. Answer. Correct answer. B. Explanation. Wearing a lead apron and thyroid shield is a primary defense against scatter radiation during fluoroscopy. This is a core tenet of occupational radiation protection. ARP report note 116 in ALARA. Standing closer A increases exposure. ABC C manages image brightness but not technologist dose. Image zoom D can increase exposure due to higher output. Reference OSHA SRP note 116 ALARA principles. Question 18. Considering the evidence, what is the purpose of using a grid in radiography? A. To reduce patient motion during exposure. B. To limit the X-ray beam to a smaller area. C. To absorb scatter radiation and improve image contrast. D. To enhance the photostimulable phosphor plate performance. Answer. Correct answer. C. Explanation. Grids are used to absorb scatter radiation, which improves contrast in radiographic images. Scatter degrades image quality by reducing contrast, especially in thick or dense body parts. Motion A is controlled by immobilization and exposure time. Beam size limitation B is the function of collimators, not grids. Phosphor plate performance D is not influenced by the presence of a grid. Reference Radiologic Science, Radiographic Physics Standards. Question 19. During the process of evaluating an image post-processing, the histogram appears skewed and contrast appears inverted. What is the most likely cause? A. Incorrect anatomical marker placement. B. Poor collimation during image acquisition. C. Selection of the wrong processing algorithm. D. Excessive use of a high ratio grid. Answer. Correct answer. C. Explanation. The processing algorithm chosen for an image determines the LUT and histogram values used to render image contrast and brightness. Using an incorrect algorithm e.g. selecting abdomen instead of chest skews the processing and results in improper image display. Marker placement A. Affects legal documentation but not processing. Poor collimation B. Affects scatter, not histogram directly. High ratio grids D. Impact dose and scatter, not post-processing. Reference image processing guidelines. Digital imaging standards. Question 20. To what extent does improper SID selection affect image quality in digital radiography? A. It has no effect because digital systems autocorrect. B. It alters patient dose but not image quality. C. It changes magnification and spatial resolution. D. It only affects analog imaging, not digital. Answer. Correct answer. C. Explanation. SID, source to image distance, directly influences magnification and spatial resolution. Increasing SID reduces magnification and improves resolution. Despite post-processing capabilities, geometric properties like magnification and blur cannot be corrected digitally. Digital systems do not autocorrect physics-related factors. Therefore, options A, B, and D are incorrect. Reference are image geometry principles, digital radiography fundamentals. Question 21. In the context of radiation protection, what is the recommended minimal lead equivalency for lead aprons worn during fluoroscopic procedures? A. 0.25 mm Pb, B. 0.5 mm Pb, C. 1 mm Pb, D. 2 mm E. Answer. Correct answer. B. Explanation. The minimum recommended lead equivalency for protective aprons during fluoroscopy is 0.5 mm Pb. This level ensures adequate attenuation of scatter radiation. 0.25 mm Pba is commonly used for non-fluoroscopic radiographic exams. Higher values such as 1 mm Pb-C may be more effective but are unnecessary for typical fluoroscopic applications. 2 mm Eb-D would provide excess protection and unnecessary weight. Reference SERP Report No. 116. Occupational Radiation Protection Guidelines. Question 22. What is the most critical factor in determining the appropriate exposure time for radiographic imaging? A. Patient thickness and body part density. B. The energy of the X-ray beam. C. The speed of the image receptor. D. The need for high spatial resolution. Answer. Correct answer. A. Explanation. Exposure time is primarily determined by the patient's body part thickness and tissue density. As thicker or denser body parts require longer exposure times to ensure sufficient penetration and image quality. Beam energy, B, and receptor speed, C, affect other aspects like contrast and noise but don't directly dictate exposure time. High spatial resolution, D, typically requires higher mass or faster processing. Exposure time itself is determined by body part characteristics. Reference like radiographic physics and technique principles. Question 23. In digital radiography, which factor most directly affects image contrast? A. The type of digital detector used. B. The amount of collimation applied. C. The pixel size of the image. D. The selected KVP for the exam. Answer. Correct answer. D. Explanation. KVP primarily affects image contrast by controlling the energy and penetration of the X-ray beam. Higher KVP produces lower contrast images, while low KVP increases contrast. The detector type A, collimation, B, and pixel size, C, influence other aspects of image quality but don't directly affect contrast in the same way. Reference Bushong's Radiologic Science for Technologists, chapter on image quality. Question 24. What is the most appropriate positioning technique when performing a lateral skull radiograph on a patient with an extremely large head size? A. Use a smaller SID to reduce the effective magnification. B. Angle the X-ray tube to reduce the appearance of the paranasal sinuses. C. Increase the KVP to allow for better penetration of the skull. D. Use a larger focal spot size to improve resolution. Answer. Correct answer. C. Explanation. To improve penetration and achieve better visibility of the bones, increasing KVP is often necessary when imaging patients with larger head sizes. SID-A should generally be increased to minimize magnification and distortion, not decreased. Angling the tube, B, is unnecessary for routine lateral skull images. Focal spot size, D, affects image resolution but A smaller focal spot is usually preferable for better sharpness, not larger. Reference Merrill's Atlas of Radiographic Positioning. Question 25. What is the function of the automatic brightness control (ABC) in fluoroscopy? A. To adjust exposure time based on patient size. B. To maintain constant image brightness during a procedure. C. To limit radiation dose to the patient. D. To adjust for patient motion during image acquisition. Answer. Correct answer, B. Explanation. ABC adjusts the X-ray tube output automatically to maintain a consistent image brightness during fluoroscopic procedures despite variations in patient thickness or density. Exposure time may also be affected, but the primary function is brightness control. While dose limitation C is an important consideration, next direct function is brightness. Patient motion D is managed through immobility techniques, not by ABC. Reference fluoroscopy safety and technology guidelines. Question 26. Which factor most directly impacts the radiation dose delivered to a patient during a slice thickness and scan length? B. The type of contrast media used. C. Gantry speed and rotation. D. The patient's body mass index (BMI). Answer. Correct answer, A. Explanation. The slice thickness and scan length directly affect the radiation dose because thinner slices and longer scans require more X-ray exposures. While contrast media B may affect image quality, it does not directly impact dose. Gantry speed C and rotation influence scan time but is secondary to slice thickness and length in determining radiation dose. BMI D may alter image quality but has a less effect on dose compared to scan parameters. Reference Radiology Safety and CT Radiation Dose Management Standards. Question 27. In terms of quality assurance in radiology, what does the term reproducibility refer to? A. The consistency of image contrast in repeat exposures. B. The ability to produce identical images with the same exposure parameters. C. The process of reducing image noise during processing. D. The ability to produce images without any geometric distortion. Answer. Correct answer, B. Explanation. Reproducibility refers to the ability to produce identical images when the same exposure parameters are used under similar conditions. This is essential for ensuring diagnostic consistency. Image contrast consistency is related to other factors such as KVP infiltration. Noise reduction C involves adjustments in processing and equipment settings. Geometric distortion D is related to positioning and alignment, not reproducibility. Reference quality assurance and quality control principles. Question 20. Which of the following factors is most important when adjusting mass for imaging a pediatric patient? A. The size of the image receptor. B. The patient's age and body composition. C. The type of radiation shielding used. D. The type of imaging modality. G. CT radiography. Answer. Correct answer, B. Explanation. For pediatric patients, adjusting mass based on age and body composition is critical as children have less body mass and require less exposure to achieve diagnostic image quality. Image receptor size may influence technique, but it is not the main factor for pediatric patients. Radiation shielding C should be used in addition to reducing exposure but does not replace adjusting mass. The imaging modality D impacts technique choices but not mass alone. Reference Pediatric Imaging Guidelines. Question 29. What is the best way to manage motion artifact in radiographic imaging? A. Increase the exposure time. B. Use a higher grid ratio. C. Decrease the SID. D. Use shorter exposure times or immobilization techniques. Answer. Correct answer, D. Explanation. Shorter exposure times or effective immobilization techniques are the best methods to prevent motion artifact. Longer exposure times can actually worsen motion blur. A higher grid ratio B is used to reduce scatter radiation but does not address motion. Decreasing SID C increases magnification and does not solve motion-related issues. Reference Radiographic Positioning and Technique Guidelines. Question 30. Which of the following is the best method to reduce scatter radiation during a radiographic exam? A. Use of an anti-scatter grid. B. Increasing the patient dose. C. Reducing the KVP. D. Increasing the SID. Answer. Correct answer. A. Explanation. Anti-scatter grids are designed to absorb scatter radiation, thus improving image contrast and quality. Increasing patient dose B would only increase exposure and scatter, not reduce it. Lowering kVp-C may reduce scatter, but also affects image quality. Increasing SID-D can help reduce magnification and improve resolution, but doesn't directly reduce scatter. Reference SRP report note 1 to Radiation Protection Guidelines.